Hello, everyone. So today we have a guest on the show, and I will be introducing her. This is my sister, Catherine, or Kate, as I call her. So I'm switching the screen over. And so she is currently studying physical therapy up at the University of Florida. And so she wanted to come on to the stream today and talk a little bit about what exactly physical therapy is. So I guess I'll give it away to you.
All right. So yes, I'm in my second year of PT school, and a lot of times if I come home for the holidays or I'm just talking with friends outside of school, they'll ask me, what exactly do you do as a physical therapist? And sometimes it makes me laugh when they try to guess exactly what a physical therapist does. I've got massage therapist, personal trainer, athletic trainer, and those are all very different things. They kind of overlap a little bit, but physical therapists are different. And so I thought I'd come on and talk a little bit about exactly what a physical therapist is. So we have a national organization called the American Physical Therapy Association, and they are in charge of advocating for our profession, organizing it, and they define exactly what is in the scope of physical therapy practice. So they've come up with this definition that physical therapists specialize in optimizing movement. So you may think, okay, so physical therapists work with muscles, right? Movement, that's what makes you move. And I can tell you that it goes a long way past just muscles. If you think about it, everything in your body is connected to muscles, and we have four main areas of practice in PT. So we work with musculoskeletal, which means your bones and your muscles. We work with neuromuscular, so the nerves that make your muscles fire and activate. We work with cardiopulmonary, so if you believe it or not, your heart and your lungs are both run by muscles. And we work with integumentary, which refers to skin, and that overlies your muscles and protects them. So I challenge you to come up with a disease or a condition that does not directly or indirectly involve muscles. You'd be surprised just how many um, things are actually run by muscles. So if you can think of anything, I challenge you to put it in the comments below. I can tell you that it's going to be really hard. So now I'd like to talk a little bit about all the places you can see PTs, because people picture PT as an outpatient clinic. You come in, you sit on this table, you do some exercises, and then you leave. And it's actually a whole lot more than that. PTs can work on professional sports teams. They can travel around with, professional soccer, professional baseball, um, and work with that. They can also be in schools and work with children. They can be in nursing facilities, nursing homes. They can be in rehab centers, which are usually affiliated with some type of hospital where patients go after surgeries, spend a couple weeks there to get better. They work in hospitals on the acute floors. So, right when you come out of surgery, we're right there. We're trying to get you moving right away. Um, they can work in home health, so they can come to your house and do physical therapy with you um, in your own home. And they can actually work with animals, which was something I didn't know about until I got into school, which is kind of interesting. If you really like animals and you're into physical therapy, you can work with her animals, which is cool. You can also be a traveling physical therapist. So if your thing is helping people, but you also want to travel the world, you can take certain jobs for months at a time, and some of those companies even pay for housing, which is pretty cool. And then you can also go on to earn your PhD in something like rehab science, and you can work in research. And then lastly, if you want to work in the commercial field, you can work in engineering, and you can create new exercise equipment, work in robotics, wheelchairs, assistive devices, prosthetics, anything like that. Um, so if you have any interest in health or exercise at all, physical therapy is the way to go. There's so many ways that you can apply your degree, and you can really get into anything. So, which is not something I knew when I started this career. I thought, just exercise, but there's a lot more you can do. So now I would like to talk a little bit about some weird things that PTs can do that you may not think of. Um, so one weird thing that we can do is we can help out with bowel and bladder control, which you may think, ew, but it's actually like a huge problem, especially with older adults. They can have problems with either not going to the bathroom or going to the bathroom too much. And it's kind of a taboo topic. People don't like to talk about it or they're embarrassed, but if they come in and get treated, it can change their life and they can have a lot less problems and things to worry about. So, if you think about it, what controls when you go to the bathroom or not? And it's actually muscles. The bladder is one big, huge muscle called the detrusor, and it's controlled by littler muscles, which are called sphincters. And the same goes for your intestines. They're surrounded by muscles, and they're controlled by sphincters as well. And so when those muscles get weak, you end up having these problems. And how do you train a weak muscle? If you do exercises. So there's a specialty of physical therapy called pelvic floor specialists, and they can work with you, give you some exercises to strengthen those muscles and maybe make some of those problems go away, which can make a huge difference. And just to keep things interesting, I have some fun facts about bowel and bladder control in case you care to know. So it's normal to have 2 to 3 bowel movements per day. And the correct posture for that is actually a squatting position, hence the squatty potty phase that we're going through right now. You should urinate about 4 hours apart from each other. If you're going more frequently than that, it's not, maybe you didn't actually need to go to the bathroom. Women, urination should last 6 to 8 Mississippis, and for men, it should last 10 to 12. Try going to the bathroom without counting now after I told you that. It's pretty hard. And so if you have someone that's having problems or issues with this topic, maybe you should suggest they go see a pelvic floor physical therapist.
Okay.
So,
I
um,
just wanted to mention we have a few comments in the comments section, but some of them are questions we can leave until after the suggestion. But we have James and Haley are here watching, and Haley was saying that she's a pre-physical therapy studying right now, so she says this is perfect for her.
oh, awesome.
But I'll let you continue.
Okay. So something else really cool that physical therapists do that I had no idea about till I entered school is they actually work in wound care. Um, Now in present day, they're kind of moving this responsibility more towards the nurses, but traditionally, physical therapists could work with caring for wounds and selecting the right types of dressings and keeping them from being infected. Sometimes when you have surgery, the wound doesn't heal up quite the way you want it to, and it can get really infected. It can come back open, it can form tunnels. And if you ever want to see some really gnarly pictures, you can look that up online. Um, but the people that do this have like a really strong stomach. I shadowed a wound care physical therapist, and I actually saw a wound that went halfway through someone's knee, which was pretty cool. And I saw a heart surgery patient whose wound had opened back up in the middle of his chest, and they had to pack it with like this black sponge material because you could actually see his organs. And they put a wound back in to drain all the blood and pus, and they had to drain that every once in a while. Which there's some pretty interesting odors and smells that go along with that. But if you're really into that type of thing, I would suggest wound physical therapy as a career. And if you ever want to see something interesting as a bystander or shadowing, you can definitely check that out. Something that's a huge problem in hospitals, especially, is pressure sores. And you might think, oh, like your skin just gets red, you've been laying on it for a while, but it can actually become more of like a tunneling sore, and it can get really infected and really nasty really fast. So, something that physical therapists, along with the nursing staff, are responsible for is making sure that patients are repositioned every 2 hours to avoid these sores from developing. And if you've ever laid in a bed or sat in a chair for more than 20 minutes, like you have to shift yourself to get comfortable again. Well, with patients who aren't strong enough or in too much pain to reposition themselves, it can become a really big problem. So that's something that we're also responsible for that you may not have known.
That's pretty
Um,
interesting.
yeah. Something else that physical therapists can do is work with TMJ patients. So that's temporomandibular joint or your jaw joint. And a lot of people have issues with it becoming displaced or popping or clicking. It can be painful. And I know that before physical therapy school, if I had jaw issues, I probably would have gone to a physician or a dentist, and I would have never thought to go to a physical therapist. But if you think about it, what opens and closes your jaw is muscles. It's just a joint, just like your knee or your hip. So you can do exercises to make it less painful, make it work better. I know there's some measurements that physical therapists can take to check the alignment of your jaw, make sure it's in the center. So there's a lot of things we can look at that your physician may refer you to us for. Um, so another thing that we are involved in that's pretty interesting is respiratory therapy. There are actually respiratory therapists that are another specialty that are not physical therapists that work in hospitals, but we are also trained in that type of therapy. So when your lungs are trying to breathe, there's a muscle underneath it that forms a dome. It's called the diaphragm, and when it comes down and flattens, it brings the lungs with it and draws air in so that you breathe, and then when you breathe out, it comes back up. And an interesting fact about that muscle is that when you don't use it, it deteriorates 8 times faster than a muscle would in your arm or your leg. And so, if you go into the hospital because of trauma or you're having some type of lung dysfunction, you may be put on a mechanical ventilator, and basically that takes the place of that muscle. So you're not using it for days to, however long you need to be on the machine. And so when you get off it, that muscle doesn't work and you can't breathe. And that can be a huge problem because if you can't breathe, you can't exercise and you can't get better from whatever you came into the hospital for in the first place. And it becomes this downward spiral. So it's very important to make sure that we work out that muscle and we make sure it doesn't get too weak. And so physical therapists, they can systematically wean you off the ventilator by giving you intervals of being on and off. They are trained in clearing mucus by tapping on your chest and your back, which I never even knew was a thing, but it's actually pretty interesting. And they can also assist in coughing by teaching you how to either do it yourself or them applying it to you by pushing on the chest and applying extra pressure. And this is really important for people who can't cough on their own because they're too weak. Sometimes in spinal cord injury patients, when their level of injury is high up, their muscles down here shut off and they're not able to cough on their own. So that's something interesting that we can also do. And then lastly, I just wanted to talk about how vast the different ways of applying physical therapy are. You may think like you're going to come in, you're going to sit on this table, you're going to be given a stretchy yellow band, and you're going to do some really like lightweight exercises, maybe given a 2 pound weight. And I know as an athlete or a young individual that I'm beyond that. I don't need to be doing that. This is too low level for me. And I know a lot of patients are like that. They just want to get up off the operating table and go and do what they used to be doing. And that is something that you do have to start out with initially to make sure you're healing correctly and that you're working your way up safely. But there's a lot of other things that can be done in physical therapy. One of the different things that you can do is aquatherapy. So if you're someone who's having joint pain in your knee, your hip, or you're having back pain, and just the effects of gravity over land are too much for you, you can get in a pool. And the water actually, the buoyancy of the water takes some weight off your joints and it can relieve your pain so that you can do the exercise progressions that we give you with less pain. And then you can work your way back onto land. And I mean, who wouldn't want to be in a pool anyways? That sounds like a lot of fun to me. And so also the water provides a little bit of resistance, just like a small weight would. So you're working out when you don't even know it. And then also if you are an athlete and you think that you're going to need some higher level training, we have sport specialized physical therapists and they will work you really hard. After you're back to a safe point where you can be back on your feet, they will work in sport specific movements. They'll have you doing ladder drills. You can even do like benching and squatting, some higher level activities. They'll work your, basketball, football, soccer ball back into the exercises. You'll be balancing on one foot. They'll be throwing things at you. So they'll definitely get you back to where you need to be and make sure you can do all the movements you want to do before you get back to your sport, even at like the collegiate or professional level. And then something else interesting, a different type of therapy that you may not think that we can do is manual therapy. And in manual therapy, there are things called mobilizations. So if you've ever gotten to the chiropractor, gotten your back realigned, we can do something very similar. We can't call it chiropractic because that's their turf and we don't want to step on it, but we call it mobilizations. And we can readjust your spine, neck, hip, basically any joint you can think of in your body. And a fun fact about that is that the pop that you hear when you crack your back doesn't actually mean anything. We can do these mobilizations to you, and if the pop doesn't happen, it's just as effective as if the pop did happen. The pop is just kind of like a psychological reassurance or placebo effect that people like to hear. So that was kind of a whirlwind tour of physical therapy, and just kind of showed you just a taste of all the things that we can do. The profession is expanding rapidly, and we have the APTA that I talked about earlier, the organization that's constantly fighting for us to be able to perform more services for patients. Something they're working on right now is called dry needling, and it's very similar to acupuncture. So we're working on having the right to perform that in all the states. And also, we're working on something called direct access. So I don't know if you knew this, but in the state of Florida, you can actually go to a physical therapist for 30 days without getting a referral from a physician. So if you have aches and pains, you know you hurt yourself, and you think, well, I could probably work on stretching it and doing some exercises. I don't really need to go see a physical or a physician. I can probably just go see a physical therapist. You can do that for 30 days, and then if you still need physical therapy after that, then you'll have to go back and get a referral. But it can save you some time and some money if skipping that physician appointment where they're just like, oh, you need to go see a physical therapist. So um, we're trying to advertise that and be like, come try us first before you go to the physician. Um, and so thanks for listening about physical therapy. I hope my talk kind of cleared up some things that you may not have known. And if you liked my talk, perhaps you can comment below with some other health topics or physical therapy related topics you might want to hear. And maybe Jana will invite me back to talk about some more.
Definitely, yeah. So she's actually going to be coming over to my place in I think in a month or a month and a half or so.
Beginning of March, yeah.
If we have any more specific topics that you want to hear about, then we can definitely try and organize that. But we do have a couple questions in the chat that I wanted to bring up just for you to answer. And if you
Sure.
have any more while we're discussing these, feel free to leave those. This is just going to be kind of an open discussion at this point, and then later we'll move on to another section. But the first question I saw is from Haley, and she was asking, how did you get your shadowing hours?
Okay, so I got a little over 100 shadowing hours, and I will say that it is kind of difficult to work your way into clinics because there are a lot of students out there looking for shadowing hours. Basically, you either have to have a connection or just call around. Some physical therapists are very open to helping students, and they'll be like, "Oh yeah, you know, just like I'll talk to my supervisor, and you can come on over." And then some places you may have to have it in like a friend or someone's parent that's like, oh, I can get you in there. Um, and just on a side note, physical therapy schools like to see a variety of settings. So you want to get outpatient, you want to get some hours in hospitals, which can be tricky to do because of liability reasons. Rehab, you can go to a senior nursing facility, just any range of settings. They want to see that you've seen it all and that you're still interested.
And would you say there's a benefit to location as well? Because I know you were looking at some places that were pretty far away. Was it Italy you were talking about?
Oh yeah. So once you're in school, you have to do rotations, and you'll have a little bit around a year's worth of rotation time. In my program, we have 4 8-week rotations, and you can do those anywhere that your school has an affiliation with. And if they don't have an affiliation, you can work on making that affiliation happen. So, for instance, I didn't get it, but I was working on with a company that sends students to Italy. So I would have been able to go over for 8 weeks and practice in Italy, which would have been awesome. But I have a lot of other rotations that I'm going to go to, which will be just as awesome here in the States.
Definitely. So we had another question from James. He was saying that he had reconstructive surgery on both of his shoulders and a knee, and he had to go through a lot of physical therapy for those. He was just wondering how much of a say does the physical therapist have in the treatment?
That depends on what type of facility you go to. So, if you go to a facility that's directly attached to your physician's office, the therapist will have less freedom in what type of protocols they can follow for treatment. But if you go to an outstanding clinic, they do have a lot of freedom on what treatments they choose to do. There are restrictions for certain surgeries that they have to still stick to in terms of range of motion and like what types of strengthening exercises you can do over time. That's just to make sure the tissue heals correctly. But after that, the like types of exercises, we try to make it very patient centered. So if you're a basketball player, we try to do exercises that relate to basketball. Or if you like to walk, we try to make sure that you can walk. If you want to, go to the beach, we'll test your, ankle you just sprained over some uneven surfaces to make sure you can walk on sand. It depends on the patient. We try to make it very patient centered.
Okay. And then one thing I thought I remembered that there was sort of two different levels of the term physical therapist in a sense because of how much schooling you've gone through. Is that true?
Um, it used to be a master's degree, which was 2 years, and recently it's gone up to a doctor or a doctorate of physical therapy, so it's 3 years now, and you get a DPT afterwards. And then there is a PTA, which is a bachelor's degree, I believe, or a
Okay.
certificate.
So
Yeah, but
would that
that
be more of like a nursing position as opposed to a doctor in as an analogy, or is that um,
um not quite. Physical therapy assistants, they work in the same settings as physical therapists. The only thing that they cannot do is do an evaluation of a new patient. And then once the patient is evaluated and the physical therapist deems them, um, you know, sometimes the more complicated cases, the physical therapist will keep on their patient load. But if they think this patient's been coming for a while, they've been running through this exercise routine, I think a PTA can take it. They're just technically under the supervision of the physical therapist, but I know a lot of really good PTAs that are very good at exercises, so they can do their thing.
okay? Well, I'm not seeing any more questions in the chat, so I think we're gonna move on to other sections. But I think this was a pretty good conversation. I hope you liked the visual that has gone along with it.
Yes, it's beautiful.
So one thing I did want to bring up was that you are involved in the stock market competition. So I was going to see if there was anything you wanted uh, to do involving that. I'm going to be pulling that up just for a second, and we will see if I can get that. There we go. So it'll show up on your screen in a second. We had a little bit of trouble with that because of the delay from my visual to the actual stream. But what I'm showing you here is the leaderboard, and so I explained to you before the stream, you're sitting in a pretty middle of the pack fifth place right now. You are doing pretty well. I will mention that the last update, the market took a pretty heavy tank. Everything kind of went down from there, but I'm going to switch over to the historic data so you can just get an idea of how things have been flowing in the recent days. So you can actually see the current values of the stock down here at the bottom, and you'll be able to see that in a second. But red is at a all-time low of 45. Yellow is at a pretty much even 117. Green has been fluctuating a lot, but is sort of on a downward trend of 125. And blue tanked pretty hard compared to its recent high, but is still higher than everything else. So That being said, I can switch it back over to the scoreboard to let you get an idea of what proportions you have, and I'll let you decide. You can stay put if you want, or you can decide to uh, rearrange your proportions or take some or sell out on some if you want. But I'm not really sure what the prices were when you first bought in. I can't really remember which week you bought in, but I guess it's up to you. You are technically up with your money right now. So do you want to do anything or you want to stay where you are?
I guess I'll just stay where I am right now.
Okay. You're going to hold fast. So you can see that her most support is in green. So if you want to support her investments, then you can go over to the Thursday video. I'll probably put a little link up in the corner by her face that you can click on and head over there. But you can vote in the poll, and that will help this stock market competition fluctuate. So um, the last thing I want to go to is we're going to go back to the paint window, and we have a tradition on the Jono Explains Things channel to do a section I like to call Out of Your Element. So um, I did bring this up a little bit to you in the start. Let me just save this beautiful picture. It's quite well fantastic. Uh, there we go, and I'm gonna clear it off. So what I do in this section is I tried. At first, it was simply a section where I just asked a question that was completely left field for what the guest would normally know, and I realized that was kind of rough on the guest because it's not really giving the guest a chance to step up to the plate. I think I asked Carly on the first guest stream what a term in football meant, and she had no clue. But
Like,
I've since switched that to more of a within the realm of the guest's thinking, but slightly tangent from that, so that there's a little something weird with it. So what I decided I'm going to ask you is to describe um, just a normal kind of warming up stretching routine, but without any references to arms or legs. And so every time that you mention arm or leg or something that's analogous to that, I'm going to keep a tally up here in the corner. And then if it's a lot of tallies, then you can leave today with less pride than you began.
can I use
So,
muscle names?
what was that?
Can I use muscle names?
Um, I guess, yeah, because I probably wouldn't be able to know if you were talking about an arm or a leg in that situation. Oh, I see that James was thanking you for the answer, and he was saying that he has to go do homework, but he loves you.
Oh,
So
you're
um,
welcome.
I guess I'll let you think about that for a second, or if you think you're ready to step up to the plate, go for it.
Okay. Can I say upper extremity?
Um, Well, okay, so let's say the euphemisms have to be different every time. Does that make it worse?
Yeah, it does.
Okay.
Okay, so if you're gonna stretch the upper half of your body, you can start out with a side bend. And if you want to work slightly different muscles, you can look up or you can look down. That's one of my favorite ones to do in class. And then, of course, you have to do the other side. You can do a tricep stretch behind the head. Do the other side as well. I like the across the body one. I would show you some lower body ones if I wasn't um, confined to this very small space. Um, but some important muscles to work out in that region are stretching your hamstrings, those are tight, on a lot of people. Gastrocs as well, your calf muscles. I don't know if that counted. um, and your quads as well. Anything else you want?
Hmm. No, I think that's a pretty strong warm up. I did. There's been some interesting changes in my normal routine ever since I worked out with Megan because she's a dancer, so she has a lot of different stretches than I would normally do on the soccer field. But no, I definitely enjoyed learning about the different ways to get loose before working out because I feel like a lot of people neglect that. And just to clarify, it is important to stretch afterwards as well, correct?
Yes.
Yes. So that's
Um,
something that a lot of people I forget, I would imagine, because um,
and it's also important to do an active warm up and cool down as well. Static, it works, but not quite as well as keeping your body warm at the same time.
mhm. Okay. Well, I'd say you did a pretty good job of avoiding the taboo words. Um, Uh, and I feel like it probably could have had a stronger structure to the actual task at hand, but that's on me. I sort of was last minute with the decision on that, but um, this was definitely an interesting conversation, and I think that we will definitely be having you on for some more topics that are probably more specific to things that you enjoy in the field once we have you over in Orlando because that'll probably be a lot easier. Um, also, I did mention way back when, but I just wanted to reaffirm. I was thinking when you come to Orlando, we could try and do something where we have like a cover song every week. Just because I do a lot of covers on the channel, so I figured it'd be nice when we have more musical people in the house to try and get just something up every week, maybe in addition to the normal two streams that I have, just because I have a lot that I usually talk on the midweek streams, and then these streams tend to be more of a full conversation. So I figured I'd run that by you to make sure you were still up for that. But
Yeah, that sounds
um,
awesome.
yeah, and uh, so for anybody who jumped on late, this is my sister, and so she talked about physical therapy earlier, but I think we're going to be winding down here. So I want to thank you guys for watching. We did have a decent audience on today, and thank you for participating in the comments section. That's always nice in these guest conversations because then we can have some questions for further discussion afterwards. And I want to thank you for coming on. I know you're back home, aren't you?
Yeah, just for the weekend.
Yeah. So I'm going to be signing off, but once again, I want to thank you guys for watching, and I will be seeing you on Thursday with hopefully more updates on the game I'm working on. But until then, I will be signing off. So thank you.